You are dispatched to a scene for a 38-year-old female who is a victim of an assault.
Victim of an assault. Okay, so we're going to start off by doing our scene safety check, make sure the scene is safe, and then we're going to put on our BSI for me and my partner. I'm going to ask for a general impression.
You arrive on scene to find your patient lying supine on the ground. According to a bystander, the patient was struck by a perpetrator and stabbed.
Okay, so my mechanism of injury here is going to be an assault. Is this my only patient?
Yes.
All right, in terms of additional resources, I would like to have police because of it's an assault, and I would also like fire for an extra set of hands. So now I'm going to have my partner hold C-spine stabilization, and I'm going to start to approach my patient and see if they respond to my presence on scene.
They do not respond.
Okay, so I'm going to give him a verbal stimuli. Sir, ma'am, can you hear me?
No response.
All right, so now I will do a painful stimuli to see if they respond to that.
No response.
So my patient is fully unresponsive. This is going to tell me I'm going to do my XCAB method. I'm going to start off by exposing the patient. Alright, so I fully exposed my patient. I'm going to check for major extreme life-threatening bleeding.
You find none.
Alright, so now I'm going to do a blood sweep. So I'm going to be checking for any kind of bleeding that I cannot see. So I'm going to lift my gloves.
Clear.
Underneath back here.
Clear.
Any blood?
Clear.
Any blood?
Clear.
Any blood?
Clear.
Okay, so I have checked for any blood. There's no major life-threatening bleeding. So now I'm going to check for my circulation. So I'm going to feel for my pulses, my carotid and my radial pulses for the rate, rhythm, and quality.
Pulse is rapid and thready.
Okay, so I feel rapid and thready pulses. I'm going to go and do my airway. So I'm going to do a jaw thrust for my airway and check to see the patency, see if there's any bleeding, emesis, or foreign bodies in the airway.
Airway is clear.
Alrighty, so I'm going to measure and apply an OPA. Do they accept?
They do.
Alright, so now I'm going to check for my breathing, and I'm going to check for my rate, rhythm, quality of my breathing. I'm going to check for equal chest rise and fall, and see if there's any paradoxical motion.
Breathing is fast and labored, and there is no chest rise on the left side.
No chest rise on the left side. Can I listen to lung sounds, please?
Absent lung sounds, and you find a sucking chest wound.
Absent on the left side?
Yes.
Alrighty, and I have a sucking chest wound, so I'm going to apply a occlusive dressing to that sucking chest wound on the left side. I'm going to also now put the patient on oxygen. Due to the sucking chest wound and the respiratory rate and quality, I'm going to put them on a non-rebreather at 15 liters per minute. I will now going to check their skin. I'm going to check for their color, temperature, condition of their skin.
Skin is pale, cool, and diaphoretic.
Okay, pale, cool, and diaphoretic indicates that the patient's in shock, so I have them on that non-rebreather, which is great. I'm going to now check their GCS. So I will say or ask, do they have any kind of eye opening at all?
None.
Do they have any kind of verbal response whatsoever?
None.
And do they have any posturing or anything that they're obeying commands, anything like that?
None.
All right, so their GCS is going to be 3. All right, so I'm going to label this a high priority patient, and I'm going to say that we're going to transport to the closest appropriate facility, and then I'd like to request for ALS as well. So now I'm going to get to my rapid trauma assessment. I'm going to be checking head to toe for DCAP BTLS. This stands for deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. And so I'll check the head for DCAP BTLS. I'm also going to check for crepitus. I'm going to check for raccoon eyes, battle signs, any kind of blood coming from the ears, nose, or mouth.
You find a hematoma on the left temple.
Left temple hematoma. Okay, I'll note that for later, and then I'm going to move on down to the neck. So I'm going to check the neck for DCAP BTLS. I'll also feel for step-offs, and then I will also feel for or look for JVD and tracheal deviation.
Neck is clear.
Okay, so I will measure and apply a C-collar. Do they accept?
They do.
Excellent. So now I will check the chest. I'm going to be checking for that DCAP BTLS. I'll feel the ribs for my for crepitus, and then I want to check in on my occlusive dressing. Do I see any other injuries?
No other injuries present.
And my occlusive dressing is still holding?
It is.
Great. So now I'm going to listen to lung sounds again.
Lung sounds still absent on the left side.
Okay. I'm going to now move on to my abdomen. I'm going to palpate the 4 quadrants of the abdomen. Do I for decapitalis and for rigidity?
Abdomen is clear.
Okay, abdomen is clear. I'm going to go to the pelvis. I'm going to check for decapitalis, and then I'm also going to do an in and up motion to check for stability.
Pelvis is clear.
Great. Priapism.
None found.
Alrighty, I'm going to now palpate down the lower extremities, doing counter pressure while I'm palpating for decapitalis and for crepitus.
Right leg is clear.
And the same on the left leg. Counter
Clear.
pressure. Said clear?
Yes.
Alright, great. I will do my CSMs. I'm going to check for pulses
Intact.
and pulse on the left side.
Intact.
And they're unresponsive, so I cannot do my sensation and motion check. So I will now move up to my upper extremities. I'll check the right arm. I'm going to do my counter pressure and head down looking for decapitalis and crepitus.
You find defensive wounds on the hand.
All right, I have defensive wounds on the hands. I will note I'm going to come over to the left side, decapitalis and checking for crepitus.
Defensive wounds on this hand as well.
Okay, I will also note that for later. I'm going to check pulses in both upper extremities. So how's the pulse on the right
Intact.
and the left?
Intact.
Alrighty, and I again cannot do sensation and motion because the patient is unresponsive. So now we're going to check the back. I'm going to log roll the patient on my partner's count, and we will check the back.
1, 2, 3.
Roll. I'm going to check the back for any kind of decapitalis or step off.
Back is clear.
All right, back is going to be clear, so we're going to now log roll the patient back onto a long board and secure the patient again on my partner's count.
1, 2, 3.
I'll roll onto the backboard. They're going to be secured to the backboard, and now I will recheck CSM. So I'll check pulse on the right arm,
Intact.
and then left,
Intact.
and then right foot,
Intact.
and left foot.
Intact.
And again, I cannot do sensation or motion because they are unresponsive. Now they're secured to the longboard. My partner can release stabilization. I'm now going to check vital signs. So what is the patient's blood pressure?
98 over 58.
98 over 58. Okay. What about their heart rate?
104.
Heart rate of 104. Respiratory rate?
26.
26 for my respiratory rate, and SpO2 with my non-rebreather.
96%.
Okay. Is their skin still pale, cool, diaphoretic?
Yes.
All right. What about their blood glucose level?
102.
All right. And I'm going to check their pupils. I'll look in to see the reactivity of their pupils.
Pupils are pearl.
All right. We'll do another lung sounds.
Still absent on the left.
Okay. Alrighty. So I have my vital signs. I'm now going to ask the bystander if they know any kind of sample or OPQRC history on this patient.
They have no relevant information.
Okay. So now I'm going to go into my secondary head-to-toe assessment, just checking to see if there's any differences between that and my rapid trauma assessment.
No new changes.
No new changes, no new injuries. So now we're going to do my secondary injuries. So I'm going to treat. I had a hematoma to my left temporal area. I will apply an ice pack to that hematoma.
Okay.
And then I have my defensive wounds to my both hands. I can apply dry sterile dressing. Does that control the bleeding?
It does.
Alrighty. Is there any other secondary injuries that I'm missing at this time?
There are none.
All right. So now we're just going to do our reassessment. So I will be reassessing this patient's vital signs, their condition, my interventions, and our transport priority. And I'm going to reassess this every 5 minutes en route to the hospital. End.